We have an 8-year-old male whose parent says, "My son is here for a checkup. His tongue is also very red," which we see in this image. He has a fever, he has malaise for 4 days, he has bilateral enlargement of the tonsils, a swollen tongue with a white coating, and a red rash developed on his back. And we're asked, what is the most likely diagnosis? Now, this can be a tricky question because 3 of these answer choices present very similarly and share a lot of symptoms. But there are certain symptoms and situations that set them apart, and we will definitely emphasize that when discussing the correct diagnosis. So his patient is obviously sick, his body is fighting something, and we can tell that by his fever, his malaise, and his swollen tonsils. But 2 of his symptoms really stick out and allow us to identify the correct diagnosis. The first is this swollen red tongue with the white coating, which is what we see in this picture. This is commonly known as a strawberry tongue and is characteristic of an infection due to a specific bacteria, group A streptococcus. Now, before you quickly pick answer choice C, because I said this was due to a streptococcal infection, we have to make sure we consider all of the symptoms when making a diagnosis, and we cannot forget about this red rash developing on the back. Streptococcal pharyngitis is just another name for strep throat, and the patient presents with all of the symptoms for strep throat, but once they also present with a rash, the correct diagnosis would then be A, scarlet fever. Like I said, this can be tricky, so let's start by talking more about scarlet fever, and then we can come back to streptococcal pharyngitis by itself. So scarlet fever and strep throat, like I said, are basically the same condition, but it's termed scarlet fever if the patient infected with strep also presents with a rash. The rash is what makes it scarlet. This is because this is a bright red rash that can cover most of the body, and this is not a symptom seen in just strep throat. This red rash is accompanied by other symptoms of strep throat, as well as a flushed face and red lines present in the folds of skin around the groin, armpits, elbows, and knees. And as we see with this patient, his red rash is just developing. Now, this is treated in the same manner as strep throat with a course of antibiotics. Now, we know this is the correct answer choice due to the presence of the strawberry tongue and the rash, especially the rash. But let's go through the other answer choices and discuss what they are and really emphasize why they would be incorrect here. We'll start with mononucleosis. Now, this infection is more commonly known just as mono, or the kissing disease. It's caused by the Epstein-Barr virus and is spread through saliva, such as when kissing, but it can also be spread by sharing foods or drinks. This infection is most common in young adults and teens, and the symptoms include fatigue, sore throat, fever, swollen lymph nodes in the neck and armpits, swollen tonsils, headache, a skin rash, and a soft and swollen spleen. The incubation period of the virus is about 4 to 6 weeks, and the symptoms typically disappear after a few weeks on their own. There's no specific therapy to treat this viral infection, so care is typically palliative with a good prognosis, but it can take a while to go away for some patients. Now, this answer choice was one of the ones that is not like the other 3, and was likely not an answer choice that you chose for this question. But a lot of these symptoms are pretty similar. The patient can have a fever, swelling of the tonsils, and a rash, which are all symptoms our patient has. So how do we know that this is incorrect? Now, in the real world of patient care, a strep test can be done to make a diagnosis, and even if one is not done, it would be evident that this was not strep when antibiotics did not treat the symptoms. So even if you didn't do a strep test, you just gave them antibiotics, they didn't work, you would know that it's not strep, and it would be something like mononucleosis. But for this question specifically, the strawberry tongue is the symptom that indicates mononucleosis was not the correct diagnosis. This characteristic tongue appearance is due to group A streptococcus infections and not the Epstein-Barr virus, so we would not see it in patients with mono. Our patient also fits more into the typical demographic for strep more than for mono, even though that's not a limiting factor. But based on these demographics and the strawberry tongue, we know that this answer was incorrect. Now we have that streptococcal pharyngitis that we talked about earlier, and we've talked plenty about this answer choice already. This is a bacterial infection, like I said, commonly known as strep throat. This infection is most common in children, but can affect any age, and is spread through droplets or shared food and drink. Beyond the sore throat and strawberry tongue, other clinical signs of this condition are painful swallowing, swollen red tonsils, headache, fever, nausea or vomiting, body aches, and palatal petechiae. If it's treated with antibiotics, it's going to go away, but if it's untreated, it can lead to more complications that we're about to discuss. Now, we know this is not the correct answer because our patient is presenting with a rash. A rash is not a symptom that falls under the streptococcal pharyngitis diagnosis. Once the patient presents with a bright erythematous rash, we've moved on. The correct diagnosis is now scarlet fever. Be sure to keep that straight and always read all the symptoms. Next, we have acute rheumatic fever. Now, this was another tricky answer because it's also associated with streptococcal pharyngitis and scarlet fever. Now, if we start by looking at the name, similar to rheumatoid arthritis, rheumatic refers to inflammation and pain in the joints. Rheumatic fever overall can develop if strep throat or scarlet fever or possible other group A streptococcus infections go untreated, and it's an inflammatory condition that can affect the joints, heart, brain, and skin. It's thought to be an immune response to an untreated infection and therefore cannot be spread from one person to another. You cannot catch rheumatic fever. This condition typically presents about a month after the original infection, but can present anytime 1 to 5 weeks after. The characteristic clinical signs are arthritis, jerky and uncontrollable body movements, fever, and fatigue. A rash can also be seen, and heart-related symptoms include chest pain and tachycardia. If this also goes untreated, even more serious complications can present as rheumatic heart disease. This can require heart surgery and even result in death. This is treated mostly by treating the symptoms with medications to reduce inflammation, fever, and pain, but if the patient still presents with a positive strep test, then they'll be given antibiotics to eradicate that infection as well. But how did we know this was not the answer if the symptoms are so similar? We would usually be provided more patient history to know that the patient had rheumatic fever, such as a history of similar symptoms about 4 weeks ago that went untreated or not fully eradicated with the course of antibiotics. Rheumatic fever also presents with additional symptoms that our patient is not experiencing, like the characteristic joint pain and jerky muscle movements. Although the patient theoretically could develop rheumatic fever if he did not receive treatment for his current scarlet fever, he does not have rheumatic fever at this point, and therefore this answer choice is wrong. So whenever a patient presents with sore throat, fever, malaise, swollen lymph nodes, and even strawberry tongue, you are right to consider streptococcal pharyngitis or strep throat, but if they also present with an erythematous rash, then they have scarlet fever, which would be the correct answer choice here.